Alright guys, I'm Blake Christian and we're just going to be doing a quick at-home anatomy video to show you the anatomy of some of the muscles in the upper extremity. I've picked out 1, 2, 3, 4, 5, 6, 7, 8. We have 7 or 8 muscles that I think are the most important in terms of anatomy and clinically. So we'll start from the top. Our first muscle that we're going to go over, and I'm going to demonstrate on the model here, is the deltoid, which is seen here. We have an origin. It's going to be the anterior border and upper surface of lateral third of the clavicle. So the deltoid is going to originate right here on the lateral third of the clavicle. It's going to insert on the deltoid tuberosity of the humerus, so the fibers are going to run this way around the whole shoulder, which is the glenohumeral joint. It's going to insert here. Then we have, of course, a blood flow, which is going to be the thoracoacromial artery and also the anterior and posterior humeral circumflex arteries. Innervation is the axillary nerve. And then we have a few actions for this muscle. It's going to be shoulder abduction, flexion, and extension. So during abduction, you would move the arm away from the midline. And then flexion and extension, this would be extension. This would be flexion. All right, so that is the deltoid muscle. Next muscle, we have the pec major. Yep, we have the pectoralis major. I am using a female model, so it's not as prominent on the females, but it's the same area as it would be on a male. So the pec major, your insertion, you have actually 2 heads. Technically it is 1 muscle, but the clavicular head, which originates on the anterior surface of the medial half of the clavicle, is going to be right here. And then you have the sternocostal head, which originates on the anterior surface of the sternum in this area. And then the fibers are going to run this way, and it's going to insert on the lateral lip of the intertubercular sulcus of the humerus right here. So the fibers run laterally this way and insert here on the humerus. The arteries that are going to supply this muscle with blood would be the thoracoacromial trunk, and it's going to be the pectoral branch of the thoracoacromial trunk. Next, we have the nerve that's going to innervate the pec major. It's going to be the lateral pectoral nerve and medial pectoral nerve. And the clavicular head and sternocostal head, the roots are C5 and C6. And then C7, C8, and T1. And then some actions, it's going to flex the humerus. And the best way to demonstrate the actions of, I think, pec major, if you guys have ever seen anyone bench press, I mean, when you're bench pressing, you're going to be flexing the humerus. And really, it's kind of an abductor as well, due to its insertion right here. So it has multiple actions. It's used in everyday life. And this is one of the most popular muscles, especially in fitness and bodybuilding. All right, and then we have the third muscle, which is probably the most popular muscle in the body, I think. It's the biceps brachii, which is going to be here on the anterior portion of the humerus. There are 2 heads. The short head is going to be on this side. It originates on the coracoid process of the scapula up here. And then the long head, which is more lateral, is going to originate on the supraglenoid tubercle. Okay, and then the insertion is going to be the radial tuberosity and the bicipital aponeurosis, and it goes into the deep fascia on the medial part of the forearm also. The innervation is going to be the musculocutaneous nerve, which is C5 through C7, and then the artery is the brachial artery, which is a very clinically important artery. And then some actions, it's going to flex the elbow, which is this, that is flexion of the elbow, extension, flexion. And then it's going to flex and abduct the shoulder as well. And you might not know this, that's flexion of the shoulder. This is because of its attachment, it's also going to help move the shoulder as well. And then it also is a supinator, so it turns the palm outward, or it faces the palm anteriorly. And that is also one of the most important functions. Biceps are used in very small activities such as riding, pouring cups of coffee, things like that. So it's a very popular muscle. And then we have the antagonist of the biceps brachii, which is the triceps brachii. The model will turn for us. It's going to be on the posterior portion of the humerus. It has 3 heads, so you have the long head, which is on the medial side of the humerus. It's going to originate on the infraglenoid tubercle of the scapula, which is going to be in this area. And then the lateral head, which is over here, is going to originate above the radial groove of the humerus. And then the medial head, which is down here, also lateral, is below the below the radial groove. That's where that is going to originate. And then the insertion is the olecranon process of the ulna. So it's going to be on this side. It's going to insert on the forearm. All right, and then the radial nerve and axillary nerve innervate this muscle. And then we have the deep brachial artery and the posterior circumflex humeral artery are going to give it its blood supply. And then some actions. That's going to extend the forearm. So if your forearm is in a flex position, the extension is going to be by the triceps. You can see it flex right there. And then the long head extends the long head extends the forearm, adducts the arm, and extends the shoulder. So it also helps with the adduction, which is moving toward the midline. All right, and then extension of the shoulder is going to be this. Helps with extension. All right, so we got that one. All right, now we'll move on to trapezius, which is superficial back. Trapezius is this whole muscle right here. It actually is going to originate on the external occipital protuberance, which you can't really see on this particular model, but it's going to be somewhere in this area on the occipital bone. That's where the fibers start. It also originates along the spinous processes of vertebrae C7 through T12, so it runs all the way down, and then also ligamentum nuchae, which runs along the spine longitudinally. And then the insertion, the nuchal ligament, medial superior nuchal line, posterior border of the lateral 1/3 of the clavicle. So it's going to also, turn for me, it's also going to insert on the anterior and upper part of the clavicle right here. So it runs back this way. Then it inserts at the spine of the scapula as well. So turn back for me. All right, so arteries, we have the superficial branch of the transverse cervical artery, also known as the transverse cervical artery. Then we have the accessory nerve, which is part of the cranial nerves. It's cranial nerve 11. That's going to innervate for motor function. And then we have cervical spinal nerve C3 and C4 for motor and sensory. Now actions, we have rotation, retraction, elevation, and depression of the scapula. This is the scapula, so it can move the scapula in pretty much any direction. That's its main function. And yep, that's it on that muscle. And then next we have, also on the back, stay turned for me, we have the latissimus dorsi, which you can't really see, but it runs along the outer, the lateral part of the back, superficial back also. It originates on the spinous processes of vertebrae T7 through L5, thoracolumbar fascia, iliac crest, which is all the way down here. So it runs along the entirety of the back. And then the inferior 3 or 4 ribs, which is down here. And the inferior angle of the scapula, which is going to be this part right here. Okay, the insertion is going to be the floor of the intertubercular groove of the humerus. So this muscle runs up into the humerus and inserts right there. If you guys can see, it's also right here. It's going to run and insert there. So actions, it adducts, extends, and internally rotates the arm when the insertion is moved towards the origin. So you guys have ever seen people pull up on things or anything like that, or pulling anything towards you, that's going to be the latissimus dorsi. That's the simplest way to put it, so that way you guys can understand it the best. It works in perfect harmony with the deltoids and the trapezius. They're kind of antagonists, but they all work together in order to pull and push objects to create force. All right, we have a couple more left. First, we're going to go over the rhomboid major, and then we have rhomboid minor. And these two are paired, but these are the middle muscles of the back here. We'll start with major, which is the bigger one. It originates on the spinous processes of T2 to T5. So it's going to be about here to here. So it originates here on the spine, and then inserts on the medial border of the scapula. So the fibers run this way, both ways, laterally, on the medial border of the scapula. And then the artery for this particular muscle to supply the blood is going to be the dorsal scapular artery. Then the nerve is C4, C5 dorsal scapular nerve, which gives it its motor function. So it is also a big helper in retracting the scapula. It also rotates it to depress the glenoid cavity, and it helps fix the scapula to the thoracic wall, which is very important in posture. You always want to keep your scapulas retracted if possible. And then it also works with the other muscles of the back, like latissimus dorsi. They all work together back there. So it's a pretty important muscle. Then the minor is pretty much the same area. It's just a little bit smaller, and it's going to be more superior to the major. It's just smaller. And it originates on the nuchal ligaments and spinous processes of C7, which is going to be about here, to T1. So it's just a very small muscle, and they run also down to the medial border of the scapula, the fibers. And then the artery is the deep branch of the transverse cervical artery. And then the nerve is also dorsal scapular, which is C4 and C5. It retracts and rotates the scapula and also helps fix the scapula to the thoracic wall. Also important for posture. So rhomboid major and minor are paired, and they do help one another keep the scapula retracted. And once again, all these superficial back muscles all help one another. They all kind of share functions, especially in keeping the scapulas retracted. One bad thing I see a lot is bad posture, but if all these muscles are strengthened enough, that can help a lot with posture. So that's pretty much all I have for the muscles. Again, I'll just go back over one more time. We did deltoid right here, then we have pec major, then we've got the biceps brachii, then on the back, triceps brachii here, then latissimus dorsi, trapezius, which runs all the way up in the medial part of the back. Then we have, what else? I think that might, did I say triceps brachii? Pretty sure. And I think that is it. But yeah, these are definitely the most important muscles in the upper extremity, I think. And we kind of take them for granted. We don't really think about how much we use them every day, but I figured I would go over that. And just thank you guys for your time. Hope you enjoyed it. And hit the like and subscribe. I'll see you guys next time. Oh, that's funny.